All right, welcome everybody to this Q&A on trauma-informed care. I'm going to give it a few more seconds because I see people are joining. And if you don't have your mic muted, you might want to do that. Yeah, mics off is good, but video cameras on is great. I mean, you can do whatever you want. Whatever works best for you with video cameras is fine with me. It's just great to see everybody's faces. Makes it a little more human for me, but whatever works is fine. All right, I think I'm going to get started. And people may be joining, and that's fine as they join. I'm super excited to be offering this class, this Q&A for everyone today. I'm very passionate about this topic, and I think it's really important that it's a topic that more people know more about and become more familiar with. So, and I appreciate your interest in this topic too. A little bit about me, just so you have an idea about where I'm coming from. So I have a master's in education and a PhD in neuroscience. Specifically, I studied cognitive and behavioral neuropsychology and neuroanatomy. I was also a massage school director for about a dozen years and LMT for twice that. And during that time, I also became a NARM practitioner. And NARM is short for the neuroaffective relational model, which is a model that was developed for psychotherapists to work with developmental trauma. As a result of that, I would say about half of the time that I was a massage school director, I was running a normal massage program, and the other time I was running a trauma-informed massage program. And to me, the differences between the two were pretty profound. So I'm hoping that I can share, we won't be able to share all of that kind of material here today, but it's some of the things that inspire me to bring up this topic. So in terms of the way trauma is looked at in culture, we've seen a huge growth of awareness around the topic of trauma in the last 10 years. So 2014 was when Body Keeps the Score was published, and it's been a very widely selling book. And so there's been a huge increase in awareness around trauma as a result of that, which is great. But also at the same time, I think there's also a lot of misconceptions that still are present. And so it's just a matter of uh, trying to address those as they come up. In massage culture, specifically, I think a lot of us have noticed that massage can have a potent effect on people's psychology. And a lot of times things come up during a session. And as a result of that, I think there's been a wide spectrum of perspectives on how to think about that or how to address that. And on one end of the spectrum, I would say that there are individuals who are, you could maybe call them trauma avoidant. They're saying, hey, it's out of scope. We're massage therapists. We're not dealing with trauma. We're not psychotherapists. So we're not even going to talk about it. On the other side of the spectrum are those who say, hey, it seems to be relevant. Massage seems to be psychologically relevant. So let's just heal trauma with it. And those individuals will often say things like trauma is in the body and trauma can be released using special techniques. So I think that either end of the spectrum is problematic. And it's because I see both of these things come up all the time. I'm in a lot of Facebook groups for massage, and these perspectives are shown on a weekly basis. So it's one of the reasons that I was inspired to offer this Q&A, because I want to sort of shore up uh, some of these ideas and make it more clear about what trauma is and how we fit trauma-informed care into massage therapy. By the way, I forgot to mention that I'm going to be talking for about a half hour with this, and then at the second half of this, we'll be doing a Q&A, just so you know the structure of it. Okay, so what trauma is? I think we all know that there are events or the relational dynamics that come along that we would say are traumatic. And a traumatic event or situation is not just anything that's difficult or anything that's negative. Um, I think sometimes the word trauma gets overused, which is really a disservice to those situations that are actually traumatic. So we don't want to say that anything that's negative or anything that's hard or difficult is traumatic. We want to save that term for situations that disrupt normal functioning for some period of time. And that period of time could be short. It might just be a few hours after an event, or it could be a whole lifetime, depending on what it is and who that person is. So trauma itself isn't pointing to the event. We can say there are traumatic events, but when we say that a person has trauma or is dealing with trauma, we mean that that event had a lasting disruptive impact, and that as a result of it, there's an adaptive pattern that has emerged to work with that, to deal with that. And it's important to say that mention that it's an adaptive pattern. So I think a lot of times trauma is seen as, oh, it's this negative thing, it's just bad, and we have to fix it. But it's really important to understand, this is part of a trauma-informed perspective, that what happens with trauma is that there's an adaptation of some kind, and that those adaptations are brilliant. They may cause troubles in some ways, but they're also brilliant in others. So just a simple example, if you're in a car accident and afterwards you just can't get in a car because it's too overwhelming and you have a panic attack or something like that, um, clearly the trauma of that is impeding your mobility. You're not going to be able to get around like you were, but it's also brilliant. It's clearly a fail-safe way to make sure that you're not going to be in a car accident if you don't get in a car. So both of those things are happening at the same time. This is a very simple example, but just to get an idea of what I mean when I say it has a lasting disruptive impact and it's an adaptive pattern. Now, there's two ways that you can have disruption. There's two levels of disruption. One of them is a neural level, and another one is a psychological level. The neural level is a dysregulation of the autonomic nervous system, and I think we're all familiar with this. It's a fear-based uh, situation. It creates fight, flight, and freeze responses, which I'm sure we're all familiar with. And it's being driven by threats to physical safety. Individuals who have this level often get diagnosed with PTSD. And this particular level of disruption is associated with what I call shock trauma, which is often a one-time event. It could be a car accident. It could be something in a war. Um, any kind of violent act. It's a shock trauma event, and it's not a relational thing. And what I mean by relational will make more sense in a minute. It's strictly a survival, fear-based, autonomic response. On the other level is a psychological level, where we're talking about changes to psychological structures. This is a shame-based uh, phenomenon where we're talking about issues with trust or connection or autonomy or feeling unworthy, which leads then to behaviors that create isolation or not asking for help when you need it or always having to be perfect to do anything and lots of things like that. So what drives this is threats to attachment and relational safety during childhood in one's family. And individuals who have this might be diagnosed with complex PTSD or developmental trauma disorder. And this is associated with developmental trauma. So this is something that is occurring due to a relational dynamic with one's caregivers as one's growing up. And as a result, you change basically your personality. Like, this is how I'm going to deal with things. So, if there's a conflict, what am I going to do? Am I going to be funny? Am I going to be aggressive? Am I going to get really quiet? Like, these are all useful strategies. We figured out what would be the most useful strategy. So that, and it's always relational in its form. At some level, it's relational. So now you might think, okay, well, here's these two types, but um, when I have things come up about related to trust or autonomy or et cetera, I end up having autonomic responses. I have a fight or flight response. So what's going on there? And that's absolutely true. These two things are not exclusive from one another. They can join together, but there's a difference in terms of what the core issue is. So if you were in a car accident and now you can't get in a car because you keep having a panic attack, if we deal with that panic attack issue, we have dealt with the issue. Um, However, if you end up having a panic attack every time you have to think about like talking with somebody about something that's difficult to talk about, because you have trust issues or you don't feel worthy or whatever that is, if we figure out how to resolve the panic attack, we still haven't resolved the problem. We still have this issue remaining about why do you feel unworthy, and what are these autonomy issues and that kind of thing. So, hmm? Oh, someone else. So make sure your mics are off. Uh, so hopefully that's clear. So if treating the autonomic response when the main issue is the psychological structure where the disruption isn't actually getting to the core element of the issue. Um, Now, you may have read or been in talks where they talk about different types of trauma, and that's perfectly valid. I'm just talking here about like the types of disruption. When we talk about autonomic things, we're talking about the nervous system. We're not talking about psychological things. So they're very, very different phenomena. And it's actually unfortunate that we call both of them trauma, but the reason we call both of them trauma is because they both have these lasting disruptive effects. Okay, so I want to talk about some of these misconceptions. So these disruptive effects and the um, adaptations that come along with them, these are neuropsychological patterns. That's what they are. And they affect the body. There's no question that trauma has enormous impacts on the body. It's really a public health issue, really, because of how profound the effects are. But it's not correct to say that it is in the body. It has profound effects on the body, but it's not in the body. It's not a thing that you can like pinpoint and find inside. And I think a lot of massage therapists talk about it as if it is that way. It's not stored in tissues. Again, it affects the tissues profoundly, but it's not something stored in them. And likewise, it's not a thing that can be removed or released. It's not like a cancer or a virus that you can go in there and somehow extract. Um, and a psychotherapist wouldn't talk about their work with trauma as something that they are removing or releasing. It's just not the right understanding, conceptualization for what trauma is. And I mention this because I think that when we think that it's something that is removable, it tempts someone to think that they can remove it. And I hear that a lot in massage circles, this idea that maybe, we could remove it. Well, just, ignoring the scope of practice topic just it's something that maybe you could. And so I really want to convey here that it's not just a matter that you shouldn't do it because it's out of scope. It's a matter that you can't. It's not something that's removable. We can work with it. We can do all sorts of things I mean, well, we as massage therapists, but psychotherapists can help with it and navigate it and manage it, but it's not something you remove. But the other thing is that even if you could, it's not, there's no technique. I get this question a lot when people hear about my classes on this topic. They say, oh, are you going to be teaching a massage technique that will, you know, help people heal trauma? Like, no, it doesn't make sense. It's not like we don't know petrissage and petrissage is gonna solve it. And there's no special technique, touch technique that could heal trauma. We already know all the techniques. Um, what's really, the way that we work with trauma is in relationship with people, and it's how we respond to people. It's not about how we touch them. It's kind of like thinking you could turn a page in a book with a TV remote. It's just not the right thing. We're not at the right level of thinking about it. Um, so, again, massage might bring up people's memories of trauma, and they might bring up emotions, but doing that isn't healing trauma. And I think a lot of people mistake those two, like, oh, something came up, so therefore this was helpful. But it's not, and number one, it's not helpful. And number two, it's actually often quite harmful. Um, so like if you were to go out and you find some kind of ancient artifact in your backyard, that wouldn't make you an archaeologist. In fact, what you found could be a can of worms. That's kind of what's happening here is, you don't really know what you're getting into. And just because you found something doesn't mean that you can actually help with it. So again, we could just skip over all this by saying it's out of scope, but I want to be conveying that even if it wasn't out of scope, like it's not something that you want to poke around at, because it could mess things up, and also because it's actually not going to resolve it in the first place. Okay, so that leads me to talk about what is trauma-informed care. Like, well, it sounds like I just, nixed the whole idea of massage and trauma together, but that's not actually the case. I think it's very important that massage is trauma-informed. In fact, as a lot of my students would say, I can't imagine massage, doing massage and not being trauma-informed. But trauma-informed is not a method for treating trauma. It's a framework designed to create a safe and supportive environment for individuals who are working with trauma. It's kind of like being ADA compliant. Like you can be ADA compliant by putting in, a wheelchair ramp, for instance. That doesn't mean that you know how to do hip surgery, right? You're just ADA compliant. Um, or CPR, you don't need to be a heart surgeon to be able to help somebody who's having a heart attack. It's the same idea with trauma-informed care. You don't need to treat trauma to be able to show up more effectively for somebody who is dealing with it. And this can be applied across all professions. Um, Anybody can be trauma informed. I mean, a banker, an accountant, a computer programmer, a geologist, I mean, all those people can be trauma informed. The more you're interacting with people, the more important it is to be trauma informed. So, a geologist could probably get away with it, but at the same time, a geologist isn't only working with rocks. A geologist also has to interact with people sometimes. And so their job is going to be better and more pleasant the more they can be trauma informed because they're working with their coworkers and that kind of thing. So anybody can be trauma informed. Trauma informed care is specific for when you are working with people in a helping or caring way. So anybody in the health profession, or teaching professions or social work, that's where trauma-informed care kicks in. And the more that the setting has an element of some power differential, like client therapist, the more that there's boundaries that are that are at issue somewhere, the more that there's someone is expressing needs and they're either going met or unmet. Either way, well, either of those is important. The more touch is involved, and the more easy it is to re-traumatize in one's profession inadvertently, the more relevant it is to be trauma informed. And so, if you look at that list, you can see that a massage therapist, ticks off all those boxes. Especially the touch part. I mean, we're not psychotherapists, but psychotherapists don't do touch. So in many ways, a massage therapist actually is probably the most important profession to be trauma informed in, because touch brings up so much for people. Okay, so what do we mean by trauma informed? Classically, trauma informed refers to four different things. We call them the four R's: realize, recognize, respond, and resist re-traumatization. Realize is pointing to just being educated and understanding what trauma is and how it has an impact. psychologically, socially, biologically, neuroscientifically, all those kinds of things. And all that could be conveyed in a lecture. So you could go and take a class and you could check off the R, the first R of realize by hearing about what trauma is and what it does. The next three, though, are a little bit more involved. So learning how to recognize symptoms. So you can identify this person's having a freeze response, this person's having a fight or flight response, but even more, but those are easier because they're autonomic, but the um, developmental trauma pieces, those are a little more uh, complicated to identify. So it's one thing to identify it, and then the next thing to respond to it. What do you do to respond effectively to it? If someone's having a panic attack or they're having a freeze response, what's the proper response to that? And if they're responding in a way that relates to their developmental trauma, how do you respond to that? And what am I referring to there? Have you ever had clients that do things that annoy you? Do you know people who do things that are annoying or disturbing in some way? Like, I mean, anything that people do that basically is hard to work with is coming from a developmental trauma um, place, and and more than that. So, how do you respond to that effectively? Because I think a lot of times what we just want to do is say, "Gosh, I just want to like get through this hour with this person and then be done." But maybe we can find a better way to do it. And then more important, and part of that is doing it in a way that resists re-traumatization. And the reason this is mentioned is because there's a whole bunch of things that people think are good ideas for how to respond that actually aren't good ideas, that are actually re-traumatizing. So let me give you some examples. Um, one of them is revisiting traumatic events. So let's say something comes up for somebody and one might think, oh, well, just, let's be conversational about it. You can just tell me more about what happened. That seems innocent enough, right? But that's actually probably not going to be a good idea. And some people come from a more like pseudo psychological place where they're saying, oh, well, let's just dive into it. Let's process, that experience. That's what people used to think was a good idea in psychology, but we quickly realized in psychology that that's actually a really bad idea. That doesn't work. That makes things worse. So going back into traumatic events is a re-traumatizing kind of thing to do. Um, the second thing is promoting emotional expression. A lot of people think, oh, the healing is in the feeling. If we just expressed our feelings more, everything would be better. That's a very popular idea. Um, sometimes people think, oh, if they just, scream or punch pillows and that kind of thing, that's good. But psychology well, that was a popular idea in psychology a long time ago. And now we know that's actually not a good idea. So but because it's so popular in culture, it's something that we sometimes promote, even though we're not really thinking about it. So we don't want to do that. Oftentimes we think, oh, it was a powerful experience. So therefore, it was a healing experience, but that's actually not the case. There's no correlation between something feeling powerful and being healing. And often is the case that it's actually the opposite, that the more powerful it is, the more re-traumatizing it is. So we don't want to promote that. Third is engaging in any kind of embodiment or somatic practices. Now, we would think as massage therapists that that has to be a good thing at all times, right? We're doing touch, we're helping people become more aware of their bodies. Seems like a good idea. And I'm not saying that it's never a good idea. But if you take somebody who has trauma and are they have a lot of very difficult feelings, um, there's different ways you could deal with that if you don't want to deal with difficult feelings. You could drink alcohol so you don't feel them. You could take drugs so you don't feel them. You could get really busy so you don't feel them. Um, or you could just tune out from those feelings, just ignore them completely. Those are all strategies, so you don't feel terrible. So if one has a strategy to not feel one's feelings, to feel one's body, then going into a situation where you are feeling your body more, as one is sometimes when getting a massage, that's just diving straight back into the thing that they didn't want to do. So this is true for people who take, mindfulness classes. They think it's a really great idea, but it actually ends up, becoming very problematic for them. So we have to realize that what we think is always a good thing, embodiment, um, it's actually much more complicated than that. And then the last one on this list here is pushing agendas. So it's very easy to take on the role of I'm the expert, I know what you need, and so here's what we're going to do. And that's good. It's good to be confident in what one is offering, but it's also important to do it in a way that doesn't undermine client agency. So sometimes if we our uh, uh, bring an agenda to sessions, that has a way of being re-traumatizing too, because it recapitulates old dynamics that the person may have had in their family. Okay, there's many other examples. Those are just four of them, but you can see why being a trauma-informed massage therapist would be really important, because you would need to know some of these things. You would need to know that actually touching people in a way that makes them feel good, which is under the embodiment category here, could actually make them feel worse tomorrow. So, um, yeah, so that's part of being trauma-informed. So just in conclusion here, as we wrap this up, I want to make sure that we understand that there's two types of disruption that can occur. You have the autonomic disruption, and you have the psychological structures disruption. And they correspond pretty closely to the two types of trauma, the shock trauma for the autonomic and the developmental trauma for the psychological structures. Uh, we want to be clear that trauma is a neuropsychological pattern. It's not a thing. It can't be released. It's not a thing in the body. It's a nervous system pattern. And that trauma-informed care is not a trauma treatment. It's something that can be, anybody can be doing. It's non-pathologizing. It comes from an approach of seeing every problem as an adaptation. And it has those four R's: realize, recognize, respond, and resist re-traumatization. And that's going to involve, for massage therapists, that will at least involve learning how to regulate the autonomic nervous system if something comes up for somebody, and learning how to optimize the client therapist relationship, particularly when there's developmental trauma that's in the picture. So that's what I wanted to share today. And I do have a class coming up that I'll talk about at the end of this on trauma-informed care. It's a 13-hour CE class. I'll share more about that later. But first, I want to open up the rest of the time here to any questions that you have.
I have a question, Mark.
Okay.
You talked about two types of trauma. One, it's in the body, and the other one's psychological. And you mentioned that the psychological trauma typically stems from childhood. Is this always usually the case, or are there, variances to that?
Well, yeah, I mean, in this, in a half hour, I can't cover all of it, but it's generally good to just think in terms of these two autonomic versus psychological categories. And then, um, so in the psychological one is going to be more coming from, how you formed as an adult. I mean, as a child. But of course, as an adult, you could have an experience, like you could be in a relationship with somebody that was traumatic. You could be kidnapped, and that could go on for, months or something like that. And that would be traumatic. And that would certainly impact you, no question. So it doesn't come neatly into, well, it's either a one day, like a one moment thing, or it's a long-term relational thing. There are more options to it. But if you were to be kidnapped, as a 30-year-old, that would have a different impact on you than, as a 5-year-old. So, um, your psychological structures probably wouldn't be as affected quite as much as a 30-year-old. You would probably still be just implementing your strategies. I mean, it's hard to say. You can't make any rules here, but your way of showing up, your personality is gonna get pretty set during childhood, and it's not going to change much, from experiences as an adult. Um, I mean, we could uh, pick at this, all day easily. But did I address your question or?
Yeah, that makes so much sense. Yeah, you addressed my question. And I just wanted to make another quick comment too. I don't want to hold the floor. I know other people probably have questions, but this is really enlightening because my mom, I gifted her a massage like several years ago, and she was so upset because she said she doesn't like to be touched. And then several years later, actually just recently she told me that she didn't realize that she could actually talk to her massage therapist and tell them how she likes to be touched. So it seems like a big part of this too is people make like if I have a traumatic response, I may not realize that going to massage would can trigger something like that. So I think this information is so important.
Yeah, absolutely. Right from a like before I had the trauma informed perspective, if I heard somebody say, I don't like to be touched, I would just think, well, what do you mean you don't like to be touched? And I wouldn't be thinking about it in any kind of psychological terms. I would be thinking about like, well, it just doesn't feel good, or like, what does that mean? Um, so yeah, understanding like, well, why? Because I mean, it forces you to feel. And it's probably not so much that the touch doesn't feel good. It's probably more so that it forces you to be aware of feelings that you don't want to be aware of. And then yeah, the piece around being able to ask for what you need, that's a part of a developmental trauma, early childhood trauma of, it's just better if I just don't, have needs, because evidently when I have needs that my parents get mad at me. So I'll just shut up and won't say what I need. And those people, they often become healthcare providers. They often just take care of everybody else's needs and not their own. Um, and a lot of times, they get proudful of that. They'll say things like, I haven't taken a vacation day in 10 years. How about that, huh? And then they're proud of this. It's like, well, maybe you should. Um, but to them, it's great. Like, see, I don't need it. I don't need anything. Um, so yeah, but those individuals, when you get on our tables, um, they don't really get what they like because they don't say what they like. And then they often don't come back because they didn't like it. Yeah. Does anybody have any other questions? Sometimes it's not easy to know what the question is. So I'll give it a lot of space to see if they form. And I'm curious if anybody relates to any of this, or if they have any clients that they think, oh, this would be, I've seen things and I don't really know how to respond to it, or maybe, even in massage school, you might have experienced, um, things come up in the classroom. Because I mean, I'll just say this right now that um, a lot of people go into massage school thinking this is going to be awesome. I um I like getting massage or I like giving massage and but sometimes people say things like I sometimes having trouble connecting with people. And I think that going to massage school is going to be really good for that. I'll probably be able to make really good friends and every day we connect with each other, it'll probably be really helpful. And on one level, they're correct. Um, it will because you will be um, basically forced to be hanging out with people all the time, and you're basically forced being to be vulnerable to some degree, right? Because you're getting on a table, you're not wearing as many clothes, and you're touching people. That's vulnerable. But what they don't realize is that if those some of those individuals have a strategy of well, because it's hard to connect, I often just don't connect. And like they simultaneously want to connect, but at the same time, because it's hard and uncomfortable, they often design their life in a way so that they don't really have to most of the time. So the part of them that wants to connect says, let's go to massage school. And then the part of them that says, I don't really want to do this, after a while, isn't really liking it. And maybe about 4 weeks in is saying, oh my gosh, what am I doing? Um, I'm freaking out. I want to get out of here. It's the flight response oftentimes, or any other number of responses. So um, maybe you can think of someone in your course who, you know, had a tougher time because basically they're being touched all the time, and that was hard for them, actually. They may have had days where they thought, this is great. I'm feeling things that I've never felt. And then that has a backfire effect. And they're like, well, I don't really want to feel those things actually.
This is Carla speaking. Um, I've been a massage therapist since 2008, and I think what you've presented today is a good introduction, particularly to your course. And I think the comments you made about re-traumatization were something that were helpful to me to hear. Obviously, over time, and certainly in my massage program, I mean, we were taught to inquire of our clients and ask for not just feedback, but the whole boundary piece and allowing the client to control what their session was. I had also done continuing education with regards to oncology and hospice. So feedback being very, very important. But from the trauma perspective, hearing about the re-traumatization, just, I mean, asking them any questions about it. The one incident that I can think about where it was really prevalent in my mind is going to do chair massage at a um, wasn't a women's shelter, but it was a program that provided services to women, particularly, and it was a chair massage event. But when I was up near the client's neck, shoulders, she got anxious, and asking less questions in a chair massage situation than you might when you've got somebody coming into your treatment room. Um, she, as she got anxious, she told me that she had been, somebody had tried to strangle her. So not knowing that going into it, you don't know to stay away from a particular area of the body or, let alone, the trauma of that situation and what that was bringing up for her in having chair massage. So, this was a number of years ago, but certainly was a learning experience for me.
Yeah. Yeah. And I mean, do you think that they even knew ahead of time that they would have a response to that?
You know, because it wasn't somebody that I knew until she walked into the room, I have no idea. But, obviously she was obviously comfortable enough telling me in that situation, this is making me uncomfortable and this is why. But, you know, and she knew enough to say, my boyfriend or whomever tried to strangle me and tell me that. but I don't know that she necessarily knew what to expect walking into the room of what a chair massage would entail, and that I would be up, with my hands close to her neck, not around her neck, obviously, but close to her neck, massaging the shoulders. And, just if you think about massaging the upper traps and the not the supraspinatus, well, supraspinatus, or if you were working like Lev Scap, at all, that was getting close enough to where her area of trauma in that situation had been. So,
Yeah.
not knowing what, her not knowing what to expect in terms of what my movements might be, might have been something new for her.
Yeah. Yeah.
So,
And in that case, she was able to have a consciously put it together. But in a lot of cases, something could come up for somebody and they don't know
right.
why all of a sudden they feel panic or whatever it is. So, you know, we have to be able to know how to respond, whether they can tell us why or not. So, yeah, there's so much there to sort through and learn about. I mean, it really comes down to being able to be responsive, like to listen well, right? It's not about that's why when people say, what technique are you going to use? Like, it's not a technique, it's about listening and noticing, oh, this person is something just changed and I need to check in and forget about what I thought I was going to do and go with the flow with what needs to happen now. Um, so yeah, thank you for that.
I do think too, active listening skills. I mean, I'm not connected to the education world now, but I think, I was an adult working a full-time position when I went through massage school and had been exposed to active listening skills for years. But I wonder if that's something that is taught enough in massage programs in terms of, you know, listening and being able to respond in appropriate manners without the re-traumatization, because instinct to me might be to ask some more questions that might further that. So that is a piece that I'm taking from your conversation today, your presentation today, and thinking, I need to think about this. I'm not seeing a lot of clients right now, but I need to think about this when I'm in that active listening mode, being aware of what is distressing to the client. So
Yeah. Yeah, because it would be so easy to say, oh, well, what happened? Or where did, he have his hand? Like that's very innocently enough, right? Is to just, you're caring about it and asking caring questions, but that would really just kind of go in the wrong direction with it. So yeah, I don't think active listening skills are something that's common enough in massage schools. I can't say that I've taken a survey, but um, I don't really think it's something that shows up very often.
well, and even in that active listening, I mean, if my inclination would have been said, somebody indicating that it was uncomfortable, you know, not painful, not whatever, but uncomfortable. If I'm asking further, can you tell me what makes you uncomfortable about that? You're still getting into that re-traumatization in a
Yeah.
sense, because you're still making them tell you more about that. And yet, how do you balance, is it a physical discomfort? You know, is it an expression of something else that's going on, or is it just my pressure's too great, or then I'm hitting a nerve that's causing some referral someplace else, or
Mhm.
is it something that is more ingrained in the body from an experience that they've had?
Yeah, thank you so much for
Yeah,
making that clarification there. Absolutely, I
yeah.
agree. And that's the kind of thing that we practice in the larger classes, how to respond in those kind of moments. We practice them actually. I don't just put up a bunch of notes on the board. We actually, get together um, and we would act out that scenario and practice actually doing it until it was comfortable to respond to it.